Good evening. Assalamu alaikum, ladies and gentlemen, and all the viewers out there. I want to thank you for joining us this evening with our current discussion about coronavirus, COVID 19, also known as. We have several doctors with us to discuss the topic for our community, even though it's affecting everyone throughout the world. I wanted to invite some of our Bangladeshi doctors to discuss the topic for our Bangladeshi community, especially since a lot of the people in our community does not know, or there's a difference in because of language barrier and ways of dealing with things because of culture and language as well. I want to take this moment to thank Channel 52 for inviting us to this discussion. Along with me, we have several doctors with us. We have Dr. Suhail Ahmed, who's an internal medicine physician. We have Dr. Omar Hassan, who's a cardiologist. And we also have Dr. Sultana. She is a nephrologist. So thank you, ladies and gentlemen, all the doctors. Thank you for joining us. And the topic is again is COVID coronavirus 19. We're gearing toward our people, our community in Bangladesh and throughout the world that are facing this crisis that needs some guidance. Uh, my Bangla is not that well, so I will leave it to you guys. Whoever speak Bangla, please explain it well in Bangla as well as English, whichever works best for you. So, having said that, as you know, coronavirus is impacting all of us. One of the things currently, most recently, when it came out, it talked about impacting adults, mostly elderly people, people with other comorbidities, and what have you. So I wanted to ask Dr. Suhail Ahmed, being that he's an internal medicine physician, what are some of the patients that he's seeing? So what are some of the advice that he has, and what can people do to avoid contracting this virus?
Okay, so there's multiple questions here. The first question is, what can you do to avoid it? Again, common sense stuff. Wash your hands, stay away from people who are sick, and social distancing, basically. 6 feet sounds very reasonable. Wear a mask outside, have people around you wear a mask. People who are higher risk, people who are more immunocompromised, these people, they should be a little bit more careful. One of the best things you can do for yourself is to see if you can get tested. If you think you may have been exposed, but you're not 100% sure, get an antibody testing, IgG. A very reasonable thing to do. Actually, get tested to see if you had it or not. Um, the other thing to do is, if you think you're sick, stay away from other people. Give yourself a couple of days till you're afebrile before you go back out into the public. Treatment is really still kind of variable. Right now, the CDC doesn't
Give him a call, see if he
recommend.
has a problem with it.
I'm so sorry. Can you not hear me?
Yes, I can hear you, guy.
All
I'm
right.
sorry.
So right now, the CDC doesn't recommend Plaquenil or hydrochloroquine. We're not recommending that. It's mainly supportive care. There is some IV antivirals that they're using. There is a couple of antibodies that they're using. But again, really, it's supportive care. It's a virus. It should come through your system, and eventually, you should be able to pull through it. People who are older, people who have autoimmune deficiencies, people who are have a lot of comorbid conditions like high blood pressure, diabetes, asthma, smokers. For some reason, they carry more disease burden. People that get a little bit more worried about. Younger people in general tend to do better. Of course, now we're seeing isolated cases where younger people are not doing as well because they're getting these immunological flares. Essentially, it's basically the body's immune system is revving up and they're getting blood clots or they're getting similar like stuff like Coxsackie, which I think Dr. Hassan is definitely more well versed in than I am. He's a cardiologist. He knows that stuff way better than I do. But essentially, it's really common sense stuff that you should do. If you know somebody's sick, stay away from them. Again, this virus is definitely more virulent than the flu. I know people compare it. I had a conversation today where we compared it to other diseases. Yes, the death toll in general is not as bad as heart disease or bad, but you have to look at the time period. in its time period, the curve is much higher and the peak is much higher and the percentage is much higher. So that's really what you need to be aware of, essentially. If Dr. Hassan wants to talk about Coxsackies, it would be a great idea this right now.
So, okay, so let's transition into that in terms of the impact of coronavirus and cardiology. In terms of Dr. Dr. Hassan, what have you been seeing, and what are some of the things that people should take precaution over in terms of coronavirus?
As we know that the coronavirus mainly affects the lungs and your breathing, but in some patients it can affect the heart, where the heart can get weak. আমি যদি বাংলায় বলি, অনেক সময় ভাইরাস হার্টকে এফেক্ট করতে পারে, তাতে হার্টের ফাংশন কমে যেতে পারে। অনেক সময় ইনফ্লামেশন বা প্রদাহ হয়, সেখানে হার্ট এফেক্টেড হতে পারে এবং তখন হার্টের ফাংশন কমে যেতে পারে। কিন্তু তার চেয়েও প্রথমে যাদের হার্টের প্রবলেম আছে তাদের জন্য করোনা ভাইরাস বেশি ঝুঁকিকর, কারণ তাদের যদি অলরেডি শ্বাস প্রশ্বাসের অসুবিধা থাকে, তাহলে সেজন্য তার উপরে যদি তার করোনা ভাইরাস ইনফেকশন হয়, তখন তাদের জন্য এটা আরো বেশি ক্ষতিকর হওয়ার চান্স থাকে। সেজন্য সবার প্রথমে ডক্টর সুহাল আহমেদ যেটা বললেন যে যদি কারোর অসুস্থতা থাকে, তাহলে তার নিজেকে সবার থেকে আলাদা করে রাখাটা সবচেয়ে ইম্পর্টেন্ট, যাতে তার থেকে অন্য কারোর এই ইনফেকশনটা না হয়। এবং এটা খুবই ছোঁয়াচে, সেজন্য যতটা সম্ভব নিজেকে ঘরের ভিতরে আলাদা করে রাখতে হবে, যাতে কারোর সাথে যোগাযোগ বা সামনে না হন। এবং সবসময় মাস্ক পরে থাকতে হবে যদি কারোর জ্বর বা শ্বাসকষ্ট হয়। যখন করোনা ভাইরাসের একটা যদি সম্ভাবনা থাকে, তখন আপনার ডাক্তারের সাথে যোগাযোগ করে একটা টেস্ট করার ব্যবস্থা করতে হবে। প্রথমত যে টেস্টটা করা হয় সেটা হচ্ছে একটা নাকের ভিতর থেকে স্যাম্পল নেয় এবং একটা কিউটিপের মতো একটা কটনওয়ালা একটা কাঠি নাকের ভিতরে ঢুকিয়ে সেখান থেকে স্যাম্পল নিয়ে সেই স্যাম্পলটা টেস্ট করা হয়, এবং সেই স্যাম্পলটা যদি পজিটিভ আসে, তার মানে আপনার করোনা ভাইরাসের ইনফেকশন আছে। অনেক সময় এই টেস্টটা নেগেটিভ হলেও আপনার করোনা ভাইরাসের ইনফেকশন থাকতে পারে। তখন আপনার ডাক্তাররা সেটা বলবে যে যদি আপনার সিমটমসটা করোনা ভাইরাসের মতো হয়, জ্বর, শ্বাসকষ্ট, কাশি, তখন অনেক সময় টেস্ট নেগেটিভ হলেও আপনার করোনা ভাইরাস থাকতে পারে। তবে সবচেয়ে ইম্পর্টেন্ট হচ্ছে না যাতে হয় এবং তার জন্য সতর্ক থাকা এবং ফ্রিকুয়েন্টলি হাত ধোয়া। সবাই হ্যান্ড স্যানিটাইজারের প্রতি যথেষ্ট গুরুত্ব দেয়, কিন্তু হ্যান্ড স্যানিটাইজার থাকলে ভালো, কিন্তু তার চেয়েও বেশি ইম্পর্টেন্ট হবে যদি আপনি ফ্রিকুয়েন্টলি হাত ধোন, বারবার হাত ধুবেন, মুখে বা নাকে হাত দিবেন না। এবং যখন আপনারা বাইরে যাবেন অবশ্যই মাস্ক পরবেন, যাতে আপনার কাছাকাছি কেউ আসলে তার থেকে আপনার এই ইনফেকশনটা না হয়।
So along with that, I read an article recently about coronavirus impact causing stroke. Who are some of the risk factors? Who are the people that are at greater risk for that? আমার তো বাংলা তো ভালো না, সো
ভাইরাসের ইনফেকশনে আমরা দেখি অনেক সময় বডিতে ব্লাড ক্লট ফর্ম করতে পারে। অনেক সময় সেই ব্লাড ক্লট গুলো হার্টে হতে পারে, কিংবা সেটা লাংসে হতে পারে, কিংবা সেই ব্লাড ক্লট ব্রেনেও চলে যেতে পারে। সো অ্যাবাউট 20% পেশেন্ট যারা খুব বেশি সিক হয়, যারা আইসিইউতে আছে, তাদের ভিতরে আমরা একটা ব্লাড টেস্ট করে দেখি যে তাদের ভিতরে ব্লাড ক্লটিং বেশি হচ্ছে, তাদের ভিতরে রক্ত জমাট বেঁধে যাচ্ছে। সেটা হার্টেও হতে পারে, লাংসে হতে পারে বা ব্রেনে হতে পারে। যদি সেটা ব্রেনে হয় তখন তারা স্ট্রোক নিয়ে আসে, যদি সেটা হার্টে হয় অনেক সময় এটা হার্ট অ্যাটাকের মতো সিমটম হয়। আবার অনেক সময় যেটা লাংসেও আমরা এই ব্লাড ক্লটগুলি দেখে থাকি। তো এটার ট্রিটমেন্ট হিসাবে আমরা ব্লাড থিনার যেটা বলি সেটা হাসপাতালে দেওয়া হয়। তবে এটা সাধারণত সেই সব সময় রোগীরা অনেক বেশি অসুস্থ থাকে এবং তারা হাসপাতালে বা হাসপাতালের আইসিইউতে ভর্তি থাকেন।
Okay, I just want to introduce that we have Dr. Yusuf who just joined us. He's a pediatrician from New York, and thank you, Dr. Yusuf, for joining us.
So much.
And I appreciate you coming on board and on this busy occasion with Ramadan and your busy with your patients as well as helping Bangladeshi community with your medical residency program. I know you're very involved, and so I want to thank you for your time. So I just want to move on to Dr. Sultana. She is a nephrologist. In terms of types of patients she's seeing, in terms of how coronavirus is affecting, in terms of somebody with chronic kidney disease or somebody with diabetes, what is her experience, and what are some of the advice she may have for our Bangladeshi community, that are suffering from currently or chronic diseases such as diabetes and renal problem? Is there any additional precaution they need to take to prevent any kind of infection from corona?
Thank you. Actually, there in the nephrology, we see a lot of effects of corona, starting from very acute kidney injury to patients being very sick and started on dialysis. I have to divide my patients in like two categories. I would say the people who never had any kidney problem can get kidney problem from the coronavirus. We don't have great data depending on what exactly happens to the kidney, but whatever we have from smaller data and studies, it shows that most of the corona affected patients who comes into the hospital gets acute kidney injury, which is mostly from the dehydration, what we call pre-renal. And the dehydration starts way before the patient comes in, because when anyone gets corona, what happens that the first thing, they loses their appetite, they have a metallic taste, they stops eating. So when they do all those, and on top of the virus being very virulent and make people very sick, so they stop eating, and at some point they really get dehydrated. At that point, the whole acute kidney injury starts. And other category of patients we see is who are already chronic kidney disease and who are already on dialysis. Those are very vulnerable group, because in this pandemic we see them really getting sick if they get the coronavirus. And there are multiple things they can do to prevent, because what happens that it's dialysis is something that people comes in 3 times in a week in a facility where they come across a lot of people. And even the transport system, they come through a transport, they sit there for 3 to 4 hours, and they have significant exposure to the healthcare system. So they pick up the corona or the infection from there, and they are most vulnerable people, and they really get sick from if they get the virus. So for the prevention from if the people are healthy people getting coronavirus, for the prevention, as Dr. Ahmed said, I'm really I agree with it. That really have to do all the precautions they have to do, like this social distancing, wearing the mask. But I would say if you get corona and you're at home, not too much symptomatic to go to hospital, please keep yourself hydrated. Drink a lot of water, like water and juice, whatever you need as a liquid to hydrate yourself, Gatorade, anything. And if you're a dialysis patient, I would say be very cautious. Do everything else everybody doing, like your mask and distancing, but make sure that when you are transporting or you're coming to the facility, you maintain proper hygiene, hand washing, mask, and be really on top of hand washing and distancing. And we are also trying our best in the facilities to keep patients healthy and not to get too much crowded area or something like that. So we're trying on that too.
Okay. So I want to move on to Dr. Yusuf. As a pediatrician, which is actually a new thing that we're hearing, that next group of patients that are being impacted are younger generation pediatric populations, which is pretty much relatively new compared to when 2 months ago when it first started, they were talking about it's impacting adult. Now we're seeing that more and more children are being impacted. So what are some of the patients that you're seeing, and what are some of the things that as parents we need to be concerned about taking care of our kids, as well as what we can do for our kids to prevent them getting from infection? Dr. Yusuf, can you hear me?
Can
Okay,
you hear
good.
me?
Yes, and I can hear you.
Oh, okay. Thank you all, Dr. Daniel Huck, and thank you for inviting me. It's a very important thing that COVID, basically everybody knows, but in the children, what's happening now is very important. Something that is very important, that multi-system inflammatory syndrome in children, it has been reported. That means the multiple organs has been affected by this. CDC has sent an advisory on May 14, 2020, and they are saying it multi-system inflammatory syndrome in children. So individuals who are apparently less than 21 years old they present with a fever with evidence of any clinical other illnesses like maybe abdominal pain, vomiting, diarrhea, and most striking features is the rashes. And suddenly they go into multi-organ involvements like cardiac, renal, respiratory, or dermatological involvements, and some neurological manifestations. The way that we have been looking into it, it is not to create a panic situation, but to be more vigilant. So the CDC has been advising all the pediatrician, adolescent medicine to be more vigilant on this. When the patient presents like this suddenly with massive inflammatory syndrome, something mimicking like a Kawasaki disease in children, which is usually happening below 5 years of old. If there is no other alternative diagnosis, then consider this syndrome and the patient is that ill that multi-system inflammatory syndrome is a possibility. But at the same time, they are saying to look into consideration number 3 things. If this patient or children is looked for COVID-19, SARS-CoV-2 infection, either positive currently or in the past, that means by antibody testing, or the COVID-19 exposure in the past 4 weeks time to any symptoms that can prior to the onset of this kind of symptoms. When we as a pediatricians, you have seen there in the New York City, and was the first to diagnose cases of this multi-syndrome inflammatory conditions. And we have seen epidemiologically, although the COVID-19 first reported in Wuhan in China, but the UK in Great Britain on April 26, it has been seen that previously healthy children suddenly presented with severe inflammatory syndrome like Kawasaki disease and who is tested positive for corona. So whether there is an association between corona and this linkage is still not validated properly, but CDC is looking into it and other countries are looking into it. In Italy, in Bergamo, also in February 18 through 20, they have reported like 10 cases of it, out of which 8 cases has been positive for corona antibodies. And this is important because there are certain hospitals reported like Papa Giovanni Hospital in Italy. They have only 19 cases in the past 5 years of this Kawasaki-like anti-inflammatory syndrome, which is also published in Lancet, one of the medical journal in England. But the New York City and the USA is very striking because the first 15 patients aged 2 and 15 years were hospitalized in New York City. And all this on May 12, New York State Department of the Health identified 102 cases of it.
Wow.
So in this para, it is so important that we as a pediatrician or adolescent medicine or a physician or healthcare worker that we are working really to look into it and look into the manifestation of it. Thank you so much.
Okay, Doctor. Actually, I have a question that came up on the Facebook. It says, "How dangerous is it for grandparents to be around young kids?" So, anyone want to be able to answer that? I mean,
let me start with this because as you know, my practice involves in the epicenters of New York and epicenters of America. You can say in the Jackson Heights area as well as in Flushing, and Elmhurst Hospital was the epicenters. So during this pandemic, when it started in New York City on early March, we can say, I haven't seen any cases until 13, when we really closed down our offices. And after 20th March, we have been started getting calls. There are multiple families, grandparents are there, parents are there. So how to protect them and somebody being affected. This is very interesting for our cultural situation because most of the people lives in 2 apartments buildings, having 5 people living in there or 5 people. So anything above 4 is always a danger, is 2 bedroom and plus 1 bathroom. So in that situation, say somebody being affected already in the family. So what do you do as a precaution method there? আমাদের যারা আছে আমাদের community-তে, we fail to understand that. The first thing is important is isolation of the patients. ওকে একটা ঘরে আটকে ফেলা এবং সেটা আমরা করতে ভুলে গেছি। আরেকটা হচ্ছে যে if there is an intimate relationship between us, that has to be stopped. If the parents are there or husband got affected, wife got affected, go and lie down or sleep in a couch if that is the problem. And better be isolated totally so that it doesn't go. And all the family members must use the masks. Sanitization is an important thing. Surface cleaning is an important thing. The floor is an important thing. So we have seen, particularly I have seen, patients, the grandparents are affected, either the fathers are affected, and consecutively the children are also affected. But I have to let you know that I haven't seen any cases of this syndrome that we are talking about. I have seen multiple cases of vasculitis and Kawasaki disease that resembles, but none of them really resemble up to this, which goes to the toxic level and toxic shock. I haven't seen one yet in the New York City, myself.
Dr. Swell, I wanted to clarify. I know in terms of COVID-19, there's two strand. One is there's European strand and one is Asian strand. What's the difference between and which one is more viral? I mean, that's something that I don't think a lot of people know. There's a big difference.
We hear there's 2 strands. One is the European version, which is the one that came to the East Coast mainly, and one is the Asian version, the Chinese version, which is in the West Coast mainly. The East Coast one is supposedly more virulent. Again, it depends on who you are. If you're a sicker person, you may get a more virulent strand, and if you get the virulent strand, it'll hit you harder. But if you're a healthier person, even the virulent strand might not be as bad. again, it really depends on what your baseline mortality morbidity is, what diseases you carry initially. Some people, unfortunately, are more prone for certain things to happen to them, and we don't know why yet. There's a lot of unknowns with this unfortunate condition. We don't unfortunately know. But there are two strains, but we think the immunity with the with getting one of them is enough to keep you from getting the second one. And this is anecdotal. This is not CDC's proven. Again, don't take this as gospel, but what I'm saying is that from reading all the data and all the initial stuff that we're seeing and the studies that are coming out, doctors, nurses, healthcare workers that have gotten coronavirus that are going back to work have not gotten reinfected. We don't see many, we haven't heard of any cases. So that only implies, doesn't prove, doesn't guarantee it, but implies that that one virus, one infection is enough to keep you from getting it again.
Okay.
If you follow the coronavirus itself, and if it follows all the other coronaviruses that happened before, don't forget this is one type of coronavirus out of multiple, I think 18 or 19 of them. Those guys, if you get the IgG for them, it implies an immunity for those guys at least for 2 to 3 years. So if you get this one, you're probably immune for 2 to 3 years. Again, it's not a guarantee. This could be the one unique characteristic of this COVID-19. We don't know that for a fact, but it's the assumption. Until we go 1 year out, we won't know for sure if that's really true, but that's what we assume. So that's the thing. But again, the virulence strain, we're seeing a downward tick in the eastern region. We've already kind of peaked. The disease is kind of slowing down in New York, New Jersey, the eastern suburbs, but now it's upticking in Georgia, Florida, Alabama, down in the southern states. So we don't know if those guys are going to bring back something more up here. So we're not really sure how it's going to go out. And that's kind of where we're at now. So we still are opening up slowly here, but you still should maintain social distancing. If you have the IgG, you're probably a little bit safer. You can probably be a little bit more comfortable. But if you don't, or if you haven't had it, you should still practice extreme caution when you're outside in public. And it's still wear the mask to protect other people, whether you have it or not, just in case.
Okay. There's another question that just popped up on the Facebook. It says, I guess anybody can take this question. There are recent speculation that China is having a second wave of Corona-19. What could be done that we could to prevent society from relapsing? Since we are some of us are getting better in this situation, but the question is saying, with the second wave, is there anything additional proportion?
It is. China just put 100 million people back into isolation again, into lockdown, because there is a second spike. The problem is it's a very dense country. They're big, huge cities, and they're you just need one person who's a vector to kind of do this to kind of reinfect everyone else. So when you have highly dense population, it's basically it's an infection factor. Basically. The more dense you are, the more likely your population is to get infected. To prevent it here, again, we're doing a decent job in New York, New Jersey, considering New Jersey is probably the most densest state in the whole. I think it is the most densest state out of all of the 50 states, and it's doing a pretty good job. It has a high number of instances, but it could have been much, much higher. One of the weird things that's happening is because people are staying at home, they are getting infected from people in their house. Now, whether it's somebody who's coming to visit them or not is questionable, or whether it's coming from somewhere else. But there is data that people are coming and getting infected in the house. But the only way to really prevent it is to have some sort of social awareness and stay away from people and be very careful in how you're doing. I mean, I don't know if anyone else wants to add anything else, but that's really the main way.
So one of the things that, because of our cultural values and way of our upbringing, a lot of times, I know what Dr. Yusuf had mentioned, that multiple generations living in the same house and caring for each other, it becomes very challenging, especially if you have a dada and dadi or nana nani or somebody who's older. You want to be able to take care of them. In terms of, because all of us are Bangladeshi, we have elderly parents or grandparents or what have you. and also because of besides culture, our diet and our way of living, what are some of the things that you can recommend to our people, our background, that they should take a heed? I know, like when initially, even my mother, when we talked about coronavirus, when he বলতেছে say, "Amra Musulman, amra hat dui মুখ দুই, আমাদেরকে এটা effect হবে না." But that's a false premise. I mean, it doesn't bear, it doesn't look at viruses, doesn't care what nationality or what your religious background is. We all impacted. So I think that's one of the, again, it's again my bias. I think that's one of the things that our people feels that way, that we're immune to it. As a Bangladeshi physician, you guys also know, as a medical physician, you see different ways of impacting people. And what are some of your suggestions, Dr. Yusuf, that our people need to do?
Well, thank you so much. Let me address your issues of the second wave. I think Dr. Hassan told you already. But one thing is, when there is all this lockout, is the lockout yes or no? Obviously, it is yes. It has been working. But the lockout cannot be for lifelong. Lockout cannot be forever. So lockout means isolate the case, make a proper tracing of the case, and stop propagation of the cases, and be ready for prevention. That means you are borrowing time by locking out everybody. You're borrowing time. So we have to be prepared for it, number one. How do I open it? So different departments, like shopping malls, should have their modalities of locking down and opening up. All businesses should have the modalities. All school, colleges, doctor's office, post office, mail office, everywhere. So the way of the system of life, we have to change our behavior in order to do it. We have to take precautions. We have to trace the cases. In some of the cases, even in Thailand, Bangkok, I heard each and every cases when popped up, they have a big trick on that. So tracing is a very important fact to answer your both question. And right now is important that who has the disease, who doesn't have the disease. That means who has the antibodies, asymptomatic cases prevailing, like in children. All these cases mostly having positive for antibody. So few cases is positive currently, recently. So that means the children has been affected. So how to prevent it? Logically, there is no treatment. So prevention is hand wash. Prevention is social distancing. Prevention is the masks. I think that's the best way to go. And then we can add 1, 2, 3, 4. So anybody else, any other inputs? I'll be happy to hear them.
I want to ask Dr. Sultana next question, because again, she's a mother, she's a wife, she's a physician, she's taking care of patients, and also she needs to take care of herself. One of the things that I've read an article in terms of, they call it pandemic guilt. I'm sure you're familiar with that. People that are put in this situation, you're feeling guilty because you're staying away from your family, your husband, and caring for your patients. What are some of the things that you can tell us from your personal experience, and think that people, whether it's a healthcare provider or even a stay-at-home mom taking, or family taking care of, what can they do, and what are some of the things that they can do to alleviate that?
Thank you for the question, because it's a very sensitive question. I think that we really have to focus on it now. Once we see that the number of patients are a little better, and we feel like we went through a storm. If you think like, if you tell me like, if you, how do you feel as a doctor? I feel like I went through a storm, and it had a toll on everyone. As a person, as a doctor, yes, and as a mom, yes, because of myself with isolation from my kids for more than 6 weeks. And I have a daughter who is 6 years old, and she's with me, like sleep with me, and I saw her not it was very hard for me and her from the both sides to really go through that time. And I think that people are really recognizing, and we see a lot of study coming out saying that how it impacted in our personal and the family uh, level, and as well as our social mental issues. As the simple thing, the wearing a N95 mask for the whole day, like we get the dermatitis here, we get itchiness, we get the mental clouding at the end of the day. So those are all very has a very great impact on our mental health. As I think we went through it, and we are recognizing it, and I think in the coming time we will be like, as we recognize all those things, if everyone recognizes it, so it would be very easy for all of us to share and then alleviate the problem.
Okay, as you know, time is coming to an end. So I just want to one more question that just popped up. This is for Dr. Hassan, since it's pertaining to cardiology. It says, how are the symptoms of heart attack and of, I guess, from coronavirus different from others? You're muted.
One thing I want to emphasize, as people were isolating and everybody was scared to go to the hospital, a lot of people with symptoms of heart attack or symptoms of stroke, they were really scared to go to the hospital for their symptoms. And what it did is a lot of people had to have the sad consequence of a heart attack suffering at home and not getting treated for it. So, I know the question is, how are they similar? And again, sometimes it can be very difficult to isolate what is coming from the coronavirus and what is coming from a heart attack, because a heart attack can present with shortness of breath. Coronavirus can present with shortness of breath. With the heart attack, you could feel tired and fatigued, along with shortness of breath. Coronavirus could also make you feel that way. So it may not be easy to differentiate that. But at the same time, even when people feel chest pain, they're scared that, okay, if I go to the hospital with the chest pain, I may get the virus and I may get sicker. So they wait at home, and eventually they have a worse outcome. They may have a cardiac arrest at home or something like that. So I think it's very important, because as we isolate ourselves or stay safe from the virus, other diseases don't stop progressing. Cancer don't stop progressing. Heart disease don't stop progressing. So I think it's important to be cautious that as we try to protect ourselves from the virus, we don't run into a more severe or more significant problem.
Okay. So I have another question that just popped up. It says, from the medical point of view, do you think that the rate at which states are opening is it safe? Who would like to take that question?
Let me actually start, and I'm sure everybody can chip in. According to CDC, and there are certain guidelines that you have to have a certain number of empty beds in the hospitals. You have to have a certain number of days with the dropping cases, new cases. You have to have the death rate coming down before we could start thinking of reopening. And again, it's a risk and benefit ratio on as we think about how much damage to the economy, how much damage to people's mental status from staying home, and then what is the cost that we will be paying to reopen in terms of human life and suffering and disease. On the medical end, who saw those patients suffer and get sick, we understand how sick patients can get. So it's easy for us to say, okay, stay home and don't get the virus. But for most of the people who haven't been to the hospital, who hasn't seen those terrible scenes of people having cardiac arrest and getting on the ventilator and dying back to back, it's hard for them to understand what the scenario is in the hospital. So I understand the frustration of general population who are stuck, who feel like they're stuck at home for months. So again, I think the states are going on a slow and cautious reopening and close monitoring of new cases, new infection, tracing them, and see if the infection rates are going up. If we see that the infection rates are going up, then we may have to consider slowing things down again a few weeks or months later. But it's something that needs to be seen as we go forward.
Okay, so let me add, as Dr. Hassan says, no matter what, at certain stage that we have to open, the government has to open, because there is so much of economic injury in all levels and all spheres of life. It's very uncertain. The hurdles are there. We know all this. It is still not practical to open it, but I think at the end, people is slowly going to open. I can see it in New York City. They are slowly opening it up. But as a physicians, and what we are doing, especially in our practice in my hospitals, in my private office, we have been practicing in a different way now. Completely changed pattern. Each and every patient, we have a protocol in place. Each and every patient, we are screening over the phone before coming in here. Histories, most of this is taken ahead of time. When they comes in here, we check in the front, sanitizing everybody as recommended, and all the healthcare workers that with me, they have to be scrub everybody minimum with white coats or PPP, masks and gloves as we handle the patient. And after the patient leaves, we sanitize the each and every room. Every 4 hours, we are sanitizing the floor and the surfaces. And this is the way the practice is now going to be heading, because we cannot also open the practice. This is an essential service. We have to open at certain level, but we are very careful that somebody with an active COVID does not walk into our office. So I think the same phenomenon and practice we have to establish in many other spheres of life, and behavioral changes are added on that. Thank you.
Well, we're actually close to the end. I just wanted to say thank you for all the doctors, Dr. Suhail Ahmed, internal medicine, for your input, Dr. Sultana, nephrologist, from your perspective, Dr. Omar Hassan from cardiologist perspective, and Dr. Yusuf from pediatrics. All of you guys are wonderful, doing a great job in your specific perspective areas, and our community. Hopefully, this shed some light on them, and if they have any questions, obviously they can reach out to you guys. And I want to thank you for your time on this special Ramadan. We unfortunately, because of current situation, we cannot get together and have prayer or anything like that. But let's pray from our specific location and pray for the health and the well-being of all of us and our community at large. And at the last minute, if anybody want to say anything else in Bangla, to our Bangladeshi community, please take the time to say so.
এক নম্বর হলো সবাইকে হাত ধুতে হবে, এটা খুব মাস্ট, and মাস্কটা ব্যবহার করতে হবে. As soon as there is somebody has a fever, contact your doctor. And
I'm sorry, Dr. Yusuf, if anybody needs to have your service, can they have your information?
Yes, they could. From my perspective, is no problem.
Okay, so where are you located? And
I'm almost in the epicenters. I'm in Queens, located in Flushing and Jackson Heights area. Jackson Heights is the epicenter of it, So we just opened the practice about last week. But we have been really not seeing that many patients. Everybody is scared, but slowly they want to come probably. And we are a strict regimen and protocol we are following.
And what's the name of your practice?
Get Well Pediatrics.
Okay, low pediatrics. Thank you, Dr. Yusuf. And Dr. Suhail Ahmed, what about you? And I mean, are you open to taking new patients, and where's your location?
We are taking new patients. We're in a couple of locations. We're over in Hackensack, Paramus, and Hilden. We just started taking patients in the office now. We're advanced medical group. We're located in 92 Summit Avenue, and we've got interested. Yeah.
Okay. And Dr. Sultana, do you see private patients or you're hospital based?
We're a hospital based, but still we have office as well. So my practice is in Teaneck. So if anyone wants to reach out to me, please feel free, of course.
Okay, no problem. Dr. Hassan, how about your practice? Do you have your own practice or hospital based?
We are seeing patients in our office in Rochelle Park, New Jersey, and in Cliffside Park, New Jersey. We are also in 3 hospitals in Bergen County. So, at any hospitals, if patients show up, we take care of them in the hospitals as well.
Okay. Well, I really thank you, Tom, and I want to thank you, Channel 52, for giving us the opportunity to open up this platform for our people, our community. And thank you, Channel 52, and thank all the doctor for giving us this their valuable time. Thank you, the audience out there who's listening. We are here. You can reach out to us. We'll do our best to help anybody and everybody that needs our help. Thank you again. Thank you, the doctors, and thank you to Channel 52.
Thank you.
Wonderful night.